The World Health Organization, WHO, missed its one chance to potentially prevent the global spread of COVID in favor of protecting China's economy, it has been claimed. WHO received an email from Taiwan in relation to its concerns about atypical pneumonia cases in Wuhan in December 2019, according to Taiwanese Vice President and epidemiologist Chen Shenzhen. But the organization neglected to issue a global warning amid strained relations with the nation as a result of China's insistence on having sovereignty over the East Asian island. Instead, it accepted claims from Xi Jinping's government as Beijing attempted to cover up the spread of the virus between humans, an investigation by The Times claims. The WHO, however, said the newspaper's article contained falsehoods and baseless claims, arguing the agency's Director General treats China like any other country as a matter of principle. On January 10, the WHO had released a statement saying, "From the currently available information, preliminary investigation suggests that there is no significant human-to-human transmission, and no infections among healthcare workers have occurred." It also advised against any applications for travel or trade restrictions to be imposed on China. However, leaked recordings from January this year reportedly showed WHO Chief of Emergencies Dr. Michael Ryan urging China to be more transparent, comparing the outbreak to that of SARS in 2003. He said, "This is exactly the same scenario, endlessly trying to get updates from China about what was going on." The WHO barely got out of that one with its neck intact, given the issues that arose around transparency in southern China. COVID continued to rapidly spread in Wuhan, killing at least 18 people. The first case outside the country was detected in Thailand on January 13, followed by infections in 4 other countries. But in a tweet on January 14, the WHO insisted there was still no clear evidence of human-to-human contact. China's health ministry finally said it had evidence that medical staff had caught the virus from patients, 3 weeks after Taiwan's warning. WHO head Tedros Adhanom Ghebreyesus then held an emergency committee on January 22 and 23 before announcing publicly there was an emergency in China. However, he insisted it had not become a global problem, while thanking China for its transparency, a stance he reiterated on January 28 after a meeting with Xi Jinping. Professor. He told The Times, "There was no scientific or medical or policy justification for the stance that the WHO took in January and February 2020. That was entirely premised on maintaining satisfactory ties to the Chinese government. So at every step of the way, the WHO promoted the position that was sought by the Chinese government. The WHO actively resisted and obstructed efforts by other nations to implement effective border controls that could have limited the spread or even contained the spread of the outbreak." He added that China's success in containing the spread with border controls ironically demonstrates that if this action had been taken worldwide, the outbreak may not have become a pandemic. The WHO spokesperson added, "WHO's top priority is ending the acute stage of the COVID-19 pandemic, and we are supporting countries to implement comprehensive, evidence-based responses, based on the consistent use of public health measures and the equitable use of life-saving tools including vaccines." The Mirror has contacted the WHO for further comment.